the girl came to the hospital with abdominal pain. The doctor thinks it might be appendicitis, so she needs an ultrasound.
No, I don't want that.
Honey,
I want to go.
But in the end, she gave in. The ultrasound didn't look like appendicitis, but the doctor didn't tell the girl's parents what the symptoms were. After leaving the hospital room, they agreed that the girl had miscarried, so they came to see her while her parents were away. After a struggle, the girl revealed the truth. She was 17 years old, and she had an unwanted pregnancy. And since she couldn't get an abortion pill, so she chose to buy them illegally, and that's why there was still some placenta left in her uterus. She begged the doctor not to tell her parents. And then the girl's parents came back to the hospital room. Dr. Manning didn't tell them the truth, which made Dr. Choi feel bad. He didn't think it was right to hide the truth from the girl's parents, so they had an argument, to keep it a secret or to tell the parents. The medical director thought the only way to handle it was with a lawyer. But then the girl had a hemorrhage, and the treatment required parental consent. It became impossible to keep the truth from the parents. Dr. Manning distracted the girl's parents, and told her that if she didn't get treatment, her life would be in danger. Her parents would not have blamed her for that. Then the girl chose to tell her mother. After calming down, the girl's mother chose to sign the consent form, but she asked that it be done without her husband's knowledge. She didn't want to ruin her family, and when Dr. Choi said that the father also had a right to know.
actually, he isn't. I never told him.
In the end, the girl went through the surgery without her father knowing the truth. Watching the family reunite, Dr. Choi and Dr. Manning had mixed feelings. Louise covered her arms with pantyhose, and that's causing her skin to become infected. Dr. Sharp tells her there's a special compression sleeve she can use, but she can't afford them, and this skin bothers her.
Taking my garden shears and slicing these things clean off.
Turns out she has obesity. She's been teased since she was a little girl for being too fat, so she was put on medication by her doctor to lose weight. But the negative effects caused a skin flap on her arm, so she had to face the ridicule again.
People stare more at me now than they did when I was fat.
Louise couldn't afford the surgery because health insurance doesn't cover her condition.
This is my life now.
When Iggy tried to get her health insurance, she said that an arm lift is a cosmetic procedure. It's not reimbursable. Iggy said the woman had developed depression because of the arm problem. She even tried to hurt herself. Mental health treatment should be covered, but she still refused. Iggy went to the stairwell and complained to Dr. Sharp when he spouted off about getting reimbursed for cancer.
Then let's give her cancer.
What?
Dr. Sharp examined Louise. She found a lot of moles. When a person has more than 100 moles, the chances of developing malignant melanoma increase dramatically.
Does that mean?
That your procedure will be covered fully?
This pregnant woman has asthma, and she's carrying surrogate twins. Will found that the male fetus had high amniotic fluid pressure, and he had a congenital septal hernia. His abdominal organs have moved into his chest, and so he's squeezing the female fetus, which made it the best option to induce the male fetus. If they don't do anything, the chances of stabilizing the fetus are very low. And on the way to surgery, the woman suddenly backs out. She refuses to operate. She couldn't stand by and watch one of her fetuses die. So the birth parents called a lawyer. She warns her that she should listen to her client's choices, or face possible criminal liability.
You're not gonna force her hand with intimidation and scare tactics.
And he thinks that even surrogates, pregnant women should have the right to choose. The medical director showed up and called Will away. She thinks he's overstepping his bounds. She wanted to reassign a doctor to the case. Due to the pregnant woman's inability to afford a lawsuit, she thought maybe just do what they wanted. And Will talked about another experimental procedure. It's called fetal tracheostomy, and it's a risky procedure for pregnant women with asthma. But the woman gladly underwent the procedure. She just hoped that the twins would be delivered without incident. When the medical director found out, she tried to stop it, but Will insisted on surgery.
We're not done. I'll deal with you after.
But in the end, the operation was a success, and the birth parents were relieved to hear that.